Good evening. So, as a former caregiver for over 10 years for my father and my grandmother who had devastating losses with their battle with Alzheimer's, I learned that caregiving is often the silent, unpaid, and untrained workforce that keeps our patients alive long past the diagnosis. But yet, they're severely underserved and unrecognized. And today, I'm here to challenge that. Keep your hands up. How many of you have ever been a caregiver for someone? Keep your hands up. How many of you are currently a caregiver for someone? Keep your hands up. And how many of you will think in your lifetime you will eventually be a caregiver for someone at some point? Caregiving affects everybody. It's often the forgotten pillar in medicine and the invisible glue that keeps it together. So here, I wanted to highlight some overlapping qualities of the definition of medicine and caregiving. Medicine is defined as the science and practice of diagnosing, treating, and preventing disease. Yes, medicine, you think of doctors and formally trained staff who have received a lot of training. But caregivers are the ones who don't have any formal training, yet are upholding everything that all these professionals spent years to do, but yet they prescribe for only 15 minutes, but it is up to the caregivers to actually see if patients adhere to their prescriptions, are doing therapy, are actually getting better. And we see that yet, even in medicine, you are supported with hospital staff, administration, you have doctors, nurses, you work in teams. But caregiving can be a completely isolating and lonely time where you're just suffering and feel like you have absolutely no help. And why is that? If the people upholding and making sure that the patients are sticking to these treatments and outcomes, and the caregivers are the ones who are really in charge of these outcomes, why are they still so underserved? And I did want to highlight some overlapping clinical duties that caregivers do as well. They administer medications, they take vitals. When you have surgery, they're the ones doing the dressing changes and cleaning the wounds. They're the ones that assist with physical therapy and daily acts of living, such as getting up every day, brushing your teeth, getting you to these physician appointments. How could you even get there if you're in a state where you're immobile? You're a caregiver. They also track symptoms and the progression of illness. They are the coordinators of your plan of care. They manage pain and comfort levels. And they are the ones out of any healthcare profession that stay the most time with their patient. They are the ones that have no time off at all. They are the ones that are day in and day out with the patient. So why isn't caregiving recognized as medicine? As it eases suffering, supports healing, monitors symptoms, manages treatments, and I would have to argue is the specialty caregiving is the one that upholds the patient's dignity as more than any other profession. They are the first responders, they are the emotional lifelines of the sick, and they unfortunately are not only advocates but sometimes fighters for their patients. So, ironically, when I Google caregiving, these are the images that come up. It is almost insulting. As anybody with all those hands raised, they know that this is not caregiving. This is not at all what caregiving looks like. Caregiving is emotionally and physically exhausting. It takes a toll over every aspect of your life. As you see here, it is absolute desperation. It is not taking it day by day. It is taking it moment by moment. You have no idea what the next moment is going to bring you. In my case, I have experience in Alzheimer's, but you also have all other ailments and diseases such as nerve issues, oncological issues, and many more. But in a case where we're all aging, we're all going to get there one day, you just really are fighting day in and day out, and you do not know when the end is going to come. So in situations like this, when you're caregiving, you are socially isolated. It is so much harder to get out of the house. No matter how excited you might be for a day, it's not worth the trouble of getting out of the house. You're mentally exhausted all the time. And in my case where I have experience with dementia, you're not sleeping. They're awake. They don't have sense of time. And they are aggressive and agitated. And you're getting lamps thrown you in the middle of the night when you're just trying to sleep. But you got to work in the morning, and your boss does not care that all these caregivings, I think caregiving is a diagnosis in itself. Years to come, how many excuses are you going to give your boss day after day? They're not going to care. And then also, you have to get to work, and you need to take your loved one to whatever care you're taking they need for the day. And they're agitated, they're punching, you're exhausted, you haven't slept. And you haven't slept not one night, not two. Think about how tired you are after 3 nights. This is months and years with no sleep. You are a shell of the person you are, and which creates disease states. It is emotional labor. And on top of that, not only have you taken on the role of a caregiver, you have also taken on the responsibilities of that person that you are caregiving for. You are now maybe mowing the lawn. You are now like having to lift the decorations in the garage that you have never been able to carry. You have such an emotional and physical toll added to you. And this is traumatizing. It really does leave long-lasting effects. It creates a sense of doom. I know that is an extreme word, but when you're in these chronic caregiving states, you don't see an end. There's no timeline to this until, unfortunately, the person passes away. And in these caregiving states, as a true caregiver, you know that sometimes the best option is someone passing away. Think about how devastating that sentence is. That is what caregiving is. It's horrific. Chronic sleepless nights. This unfortunately leads to long-term illness such as depression and even suicide. You have no time throughout the day. You're just running from place to place. How are you even eating? You're getting whatever fast food and you're just scarfing it down, not even knowing anything because you're exhausted. And this also can lead to substance abuse issues and grief. And a grief that I think is often not talked about. You are grieving the loss of a person as they are actively in front of you, and you are losing them daily and slowly. That is a different type of grief that if someone passes physically, you experience that and you're able to move on and make peace with it. You are constantly being tortured and reminded, and every single day is a more gradual loss of this person that you once loved. So in my case, it is dementia. But as I said, there are so many other illnesses and ailments that I knew like something has to be done about this. There are people who have kids with cancer. There are people who had traumatic injuries in car accidents, and now they have cervical pathologies and can't move. And they need caregivers. How is this affected? I can't be the only one. 53 million people in the US are caregivers, and almost half of them receive no formal support, training, financial aid, counseling, or respite care. 1 in 5 caregivers report worsening health. Of course, how can they not? You're not sleeping, you're eating horribly when you can, and you're essentially being tortured every single day emotionally. 1 in 4 family caregivers spend over 41 hours a week on caregiving tasks. Let's say you have a full-time job, 40 to 60 hours for some. You're a mom, you have kids, you're a dad, you have practice, or your kids practice. How are you going to handle that? How? I would love someone to tell me, because it is unsustainable. That is how the person ruins themselves and leads to the caregiver becoming the patient themselves. And over 61% of caregivers are women. And of course, this obviously has a huge financial toll. Unpaid caregiving labor is valued at over $873.5 billion annually. That's just in 1 year. In my case, my dad's daycare was 80% of my mom's wage. What is she supposed to do in that situation? And we also fell into what many do is the healthcare gap, where you make too much money to get any help, but you need to make so little that you can't afford living. What is that? No formal training, no financial support, no policy protection, and no resources. for something that affects everyone and essentially is a slow killer. How does that happen? How does that go unseen? And then that is when the caregiver becomes the patient themselves. This chronic stress, the mental health decline, the physical toll. And imagine you can't take it. Your loved one needs care. You lose your job. Now you don't have any insurance. How many people have been in that situation? And it's so real. Why isn't this more recognized? Why isn't this more advocated for? I believe that caregiving is a diagnosis in itself, and it needs to have more structural support. There is too much difficult accessibility. So in my case, there's a Medicaid waiver that regardless of how much you make, it is a medical necessity for your loved one to get care. It took 3 years for my family to get that Medicaid waiver, on top of 4 hours almost every day just arguing, getting transferred, getting hung up on. After all these added tasks, I had to spend that many hours on the phone just to get hung up on. My dad died 2 months after he got the waiver. 3 years fighting, 2 months of care. Not right. And I know I'm not the only one. We need to make healthcare patient-centered and caregiver-informed. That is the only way to have the health outcomes that we're all striving for. All this research, all this aid needs to go to where the healthcare is truly carried out. And we need to stop assuming that it'll just get figured out. You prescribe the medication. What if the person doesn't adhere to it? We need to make a better plan of care. So this is done through federal financial support, institutional training, integration into care teams. Just as there's social workers and clinician offices, we need to make a social worker just for caregivers. And we need to make caregivers as a part in the office role. What do you need? We couldn't go anywhere because my dad's Alzheimer's, he unfortunately became very violent. We couldn't go anywhere. A handicap sticker could have helped us so much. Nobody told us. We had to advocate for ourselves, and you're so exhausted, you can't even think sometimes. Mental health services and holistic recognition. And this is done slowly, but being cognizant of everything caregivers have to go through. In public, we couldn't go out sometimes because if there's no shared gender restroom, if we leave my dad alone, he's an elopement risk. So we couldn't even go anywhere. So when you see people like this in public, I encourage to be more aware of what people have to go through. And just if someone's having a hard time, just be patient. You never know what is behind that person and what diagnosis they may have. And then kindness and empathy, as generic as they sound, they go a long way. And one day when my mom, this one time in a whole month where she wanted to go to the mall and she only could because this one person thought she helped her when my dad needed to go to the bathroom. And that really helped her for the whole month. As little as it could be, that's how desperate you become. It creates a ripple effect. So if we start recognizing caregivers as an integral part in medicine, we can have patients heal better and caregivers stay healthy. And that is how we get healthcare to work. Thank you.